All right, it's 11:15, so I am going to start because I know some people are actually watching, even though, you know, but I will start. So today we are going to be talking about herpes simplex virus, the herpes simplex virus type 1 and type 2. So, there are two, this is, we're talking about herpes simplex, and there are two types. So that we have type 1 and we have type 2. So we're going to talk about mode of transmission. Today I'm going to be talking in English and maybe explain in pidgin if, you know, if possible and necessary, because I need to keep the video really short. Okay, so today we're going to be talking about herpes simplex type 1 and type 2. So herpes simplex virus, of course this is a virus, and one thing I would like you to know about this virus is it's a lifelong virus, which means when you get it, it stays with you for a long time. You can only like prevent outbreaks, or take medications, antiviral medications, to suppress the virus. So herpes simplex type 1 is usually the herpes labialis, which is usually like the oral one, and then herpes simplex type 2 is the genital herpes. Regardless of which one you have, both of them are dangerous because you know they can be transmitted through sexual intercourse and through oral route, or kissing someone who is infected with the virus. You can also get it, and if transmitted to a baby, a newborn baby, is very deadly. It can cause seizures and you know possible long-term defects and even death. Okay, so today that's what we're going to be talking about. All right, so type 1 is the oral. How do you get type 1 herpes simplex virus type 1? You get it through the oral route, which means oral contact, mouth to mouth, or mouth to genital area. Okay, mouth to mouth. So which means if you kiss somebody who has the virus, then you're going to get the virus. And then if you have an oral sex with somebody, which means if you maybe do have oral sexual intercourse on the with somebody who has a virus, who has the virus in the genital area, like oral sex, okay, oral sexual intercourse, you're gonna get the virus. So those are the two ways to get type 1. And then type 2 is strictly sexually transmitted. So either rectal sex or vaginal sex, you can get type 2 virus. And then another way to get this transmitted is through mother to child. Mother to child is either type 1 or type 2. The mother can transfer it to the baby through breastfeeding, not the breast milk itself, but if they have the lesions of the virus on their breast and then they breastfeed the baby, of course the baby is going to suck on the breast, and then the baby is going to get the virus, because the lesions usually appear in genital areas. They can appear on the breast, they can appear on the mouth, sometimes they can appear in other areas of the skin, especially in children. And then another way for mom to transfer this virus to the baby is through childbirth, like through vaginal delivery. If mom already has the um, lesions in her genital area and she gives birth to the baby, of course through the birth canal the baby can get it. So those are the ways that you can get this virus. Or another way you can also get it is through close contact. Remember, if one person has the lesions on the body and you come in contact with that person, and you have an open wound on your skin and your body exchange body fluids, then you can also get genital not genital you can also get herpes virus. So those are the ways you can transmit from one person to another. But the most people, especially adults and sexually active people, usually get this virus through sexual intercourse. And like I said in the previous videos, people have sex through the mouth, through the rectum, and through the vagina. So sexual intercourse entails this three mode of you know mode of transmission, or the mode of transmission entails these three um, kinds of sexual intercourse. So that's how you can transmit the virus from one person to another. Okay. And then I'm going to say this. Um, if you are pregnant, before I move on, if you're pregnant, or if you're planning to get pregnant and you have this disease, you have herpes, because like I said, it's a lifelong, which means when you have it, you're probably gonna have it for the rest of your life, except something happens and you get healed, then you can be free from it. And then sometimes you have high outbreaks. Some people don't, some people do. But if you're planning to get pregnant, or if you're a mother, it's important that you let your physician, your primary care physician, or your doctor know that you have this virus, because you can easily transmit it to the child. And if you transmit this virus to your child, it can cause severe defects, it can cause seizures, it can cause a lot of problems, and the baby can even die from the virus. So it's very important. And then for us who are maybe, for those who are not planning to get pregnant, or those who are not pregnant, but then you come in contact with a newborn baby, a baby, do not kiss the baby, because what you don't know if you have this virus in you, and the virus is you're asymptomatic, and you can easily transfer this virus to the baby. So please do not kiss any newborn, any baby. Do not kiss them, because if you kiss somebody's baby and they come down with this virus, then you know you're gonna be held responsible. And even if it's your baby, especially if you already have this issue going on, do not kiss that baby. And if you are coming in contact with somebody's child or your child, make sure they wash their hands with water and soap, or use hand sanitizer, because like I said, people have these viruses, people have all kinds of stuff, and they do not even know that they have these viruses. They do not know that they're sick, because they don't have any symptoms, but then they shed the virus, they transmit the virus, and other people get it through them. So it's important to be very careful. Babies have weaker immune system than ours, and they can easily die from stuff that older people will not die from, especially viruses like this. So the next thing we're going to talk about is we are going to talk about genital herpes signs and symptoms. When I say genital herpes, it means this affects the genital areas, like the vagina, the penis, the rectal area. That's what this is all about. And this is usually type 2. Usually type 2. And this is transmitted through sexual intercourse. So the signs and symptoms of genital herpes. In women, they usually have burning sensation, they have ulcerations, they have tingling when during urination. Sometimes they do not have any symptoms, but then they can feel that they have something going on down there, because they do not have any lesions or any ulcerations, but then they have this tingling sensation each time they pee. It goes, they have this tingling sensation for a while, and then maybe like 2 to 3 days, and then after that it goes away. Maybe it comes back again in like 6 months, down the road, or something like that. So that's how when you have this kind of situation, and you've maybe been tested for UTI and you don't have any urinary tract infection, it's always important to let your doctor know, so they can conduct a herpes simplex virus test, because probably you have that, but because you don't have the severe symptoms, and because you don't have severe symptoms, it's very difficult for you to detect that you have the virus. So it's always important, women and men, if you're having all these tingling sensations, burning while urinating, or you're having discharge and stuff like that, it's always important to let your doctor know. I know sometimes you have other diseases that can cause that can mimic these symptoms, but then it's always good to have a test, especially if you've taken medications for what you thought you had. Maybe you thought you had like a bacterial infection or a fungal infection, and then when you took all of these medications, you realize that there is no relief. Then you have to start thinking, probably it could be something else, or it could be the herpes virus. Okay. And then When I say painful ulcerations, you have like blister looking ulcerations and lesions in your vagina, perineal, and anal area. And then when you they look like blisters when they burst open. I will show you a picture. This picture is not my picture. It's taken from Hippocrates, a learning site. So that's the oh, sorry. This is the female genital area. That's the vagina with the herpes simplex virus infection. You can see right there. You can see right there. They look, sometimes they look like blisters, and they're red and angry and itching and very painful. And they do not only affect the vulva, they can go in as much as affecting the cervix, you know. So it is very important. It is very important, man. If you are about to have get intimate with a woman and you see something like this, please stop right there and run away. Okay. And then for the women, for the men, that's the penile area, and that's what it looks like right there. That's what it looks like right there, and that's the blister, the herpes lesion or blister, whatever. And this picture is not clear enough. That's not clear enough, but that's how it looks like. Okay, so if you're about to get intimate with somebody and they open their mouth and you see something like that, that is angry looking, you know, looking at you, you need to run away, because that is probably herpes infection. And even if it's not herpes virus, it could be something else that is very deadly. So please do not. Okay, let me see if I can show you a picture of herpes 1. Herpes simplex 1. So a lot of people have probably have herpes simplex 1. Is one of the most common um, viruses around, and it usually affects the oral, you know, your mouth. So I will show you a picture of herpes type 1 on the lips. I know in Cameroon sometimes they call it co- not cold sore, but night fever. Night fever. Sorry. Herpes simplex 1 picture. And sometimes this herpes virus, the lesions and the rashes can be on the person's buttocks. They can be in, sometimes in children, they can be anywhere. But if you see, you know it, you know. So it's always good to pay attention. Parents, pay attention to your kids. Check their skin, you know, especially like kids who cannot talk. They cannot tell you what's going on. So it's always very important to check their skin, check their face, open their mouth, and check what's inside. Yes, because sometimes they have stuff going on in their mouth and they do not know about it, and they really cannot tell you what's going on. A child can be crying, but then, you know, mom wouldn't tell what's going on because the child cannot talk. So it's always good if your child's, you know, looking funny or having a high fever. It's always good to check their body, open their mouth, check their ears if possible, look, you know, everywhere. Okay. And then the next thing, so in some people who have like rectal intercourse, anal intercourse, they can also have pain in their rectal area, because that's the port of entry of the virus. They can have the blisters around their rectum. So the front part, the front area of the person can be looking normal, but then if you check their rectal area, then they'll have like lesions and they'll have pain and discharge from their rectum. So please, it's always good to check, always good to check, because these days we have bisexual, you know, men who have intercourse with men, and then they also have intercourse with women. So the fact that they do not have anything visible on their penis does not mean they do not have it in their rectal, around their rectal area. So it's very important to check everywhere to make sure you're being safe. You're safe. And then um I will talk about prevention. So prevention is better than cure. First things first, if you are infected with this virus, please, if you have this virus and you know you have it, if you know you have it, first thing to do, avoid intercourse, avoid sexual intercourse, especially if you have an outbreak or if you're having lesions or ulcerations around you. And people who have this virus, they can tell you exactly when they're about to have like the outbreak, or maybe the virus is about to come back to like to be reactivated. So they can tell you, oh, they're feeling funny, or they know the prodromes, they know the stages of um they know the stages of the infection, they know when it's there and they know when it's gone. So if you know when you're about to have the outbreak or when the infection is being reactivated, please do not have any sexual intercourse, do not have any close contact with anybody, because you can transmit it. Even if you're not having the symptoms, you can still transmit this virus to somebody who is healthy. Okay, so that's the one thing. Avoid sexual intercourse, use condoms. If you're having these outbreaks and you really have to have sex, use condoms. But one thing I'm going to tell you about condoms will only protect the area that is the body part that is using it. Okay, for example, if you put on a male condom and you have sexual intercourse with somebody, you're only going to protect the vagina and the penis from getting the what the other party has. So if you kiss somebody when you have herpes and you have an outbreak, you kiss that person, the person is going to get it. You touch somebody who has herpes and you're not having, you touch somebody who has herpes, or you come in close contact with a broken skin. I'm not saying handshake, I mean like if you have an open sore and the person has an open sore and you people, your body parts come to close contact, your hands come in close contact, of course you're going to exchange body fluids and you're going to get herpes. That's what I'm talking about. I'm not saying when you hug somebody, or when you, at least, everybody should understand what I'm saying. So if you have close contact with somebody who has a herpes outbreak, or who has herpes, even though they don't have an outbreak or even though they're not symptomatic, as long as they have the virus, you are going to get it. There's a chance that you are going to get the virus. So if you're coming in close contact with somebody, please be very careful, especially if you know you have herpes and you know you're going through a reactivation stage. Okay, and then because in that, during such stages or during such activities like touching, coming in close contact, condoms can really not protect you. So protect you or the other party. So you have to be very careful. Okay, and then if you have open lesions on your body, do not touch. If you have a lesion on one spot, do not touch the spot and touch other areas of your body, because what you're doing is you're transferring, you're contaminating the other area and making it possible for that area to develop the lesion or the ulcer. So do not do that, and do not touch areas of your skin that is broken and touch other people, because then they can always get it. And if you're breastfeeding, mom, if you're breastfeeding and you have a herpes lesion on your a hepatic lesion on your breast or nipple, do not breastfeed your child, because then they can easily get it. And then please do not kiss people. Do not kiss people, especially if they're not your partners. Do not kiss them. And do not kiss anybody. Do not kiss little babies. If I say don't kiss people, well, other people, my age group, we go around, we do stuff, we kiss people, we want to. I really don't have a control over that. But at least for the sake of the children, they're still growing, they have a life ahead. Please do not kiss any baby, do not kiss any child, because you can easily transmit the virus to this child. And if you have to hold somebody's baby or anything, wash your hands. Okay, I'm going to talk about the complications of herpes simplex virus. You can become acyclovir resistant. Acyclovir is a medication that is used to treat herpes. It's an antiviral medication. Like I said before, this is a virus, and you can only treat it with an antiviral medication. You cannot use antibacterial or antibiotic or antifungal or whatever. It's not going to do anything on this virus. You treat it with with an antiviral medication. So if you are constantly having herpes outbreaks and you're constantly getting encyclovirids, at one point your body is going to be like, this medication, I wouldn't take it anymore, and the medication will stop working for you. In this case, the doctors will have to find out what other medication they can use, to help you treat your disease. So that's one complication from herpes simplex virus, is cyclovir resistant. Another complication is hepatic keratitis, which means this is it affects your cornea, it affects your eyes, and this can be very painful. And this is an emergency, and you have to go to an ophthalmologist or an eye doctor to get this treated. Anything that concerns your eye, you have to go to like an eye doctor to get it treated. Don't try to treat it by yourself, or don't go to a pharmacy and just get something because you think you're having conjunctivitis. No, you have to go to an eye doctor. You have to go to the doctor immediately, because this can cause blindness if not treated immediately. And then also it can this herpes virus can also cause meningitis. It can also cause neonatal hepatitis, herpes simplex virus, and this is very deadly. Like I said before, for the kids, for the newborn is very deadly. If a newborn comes in contact with somebody who has this infection, I say contact, I mean close contact, somebody who has this infection, this is very fatal, because it can cause seizures, it can cause defects, and it can also lead to death. I've seen pictures on social media, I've seen family members, I belong to a lot of groups, Facebook groups, healthcare groups, and I've seen a lot of pictures of babies posted who developed herpes simplex virus, and they ended up losing their lives because somebody did not follow the instructions. Somebody just went, oh, this baby is so cute, and kissed the baby, or they didn't wash their hands after they've touched the lesions that they had, or something like that. Remember, the fact that you're not having symptoms does not mean you cannot transmit the virus to somebody else. So you have to be very careful, especially when it comes to babies. This is very important. And then another complication, guess what? Hepatic whitlow. I think most people know what it is to have a whitlow on your finger. It's very painful. I didn't know what used to cause whitlow on people's fingers. That's like when I was in Cameroon, when I was younger. I didn't know. I always thought whitlow was just something until I grew up, until I came to the United States, until I became a nurse. That's when I knew that herpes virus can cause whitlow. What's whitlow? Is that inflammation of your finger, the digital, it can affect any of your fingers, usually like blister, and it's very painful. If anybody who has had whitlow before, they can tell you it's very painful. It feels like your finger is going to cut off. It's like you're losing your sensations on your finger. I've never had it, so I really don't know how it feels, but I've heard a lot of people say whitlow is very painful. So if you don't know from today, whitlow is herpes virus can cause whitlow. That's that infection on your finger. A lot of people know what whitlow is. That's why it's very rampant in Cameroon, in some regions of Cameroon. I know when growing up, I know a lot of people who had whitlow. Several times people were like, oh, I have whitlow. I didn't know what the cause was. I don't think I've ever known the cause of whitlow until I started doing the research and studying and going to school, and I realized that whitlow is caused by hepatic whitlow is caused by herpes virus. So that's another one. And then another thing is herpes simplex virus, especially type 1, when it's in your oral mucosa, in your throat, in your mouth. Type 1 and type 2 both can cause that. They can also cause esophagitis, throat problems, pain swallowing, lymph nodes, painful lymph nodes. They can also cause trouble breathing, because if you're having lesions in your throat, at one point you might end up, if care is not taken, or if you're not being treated in the appropriate way, you might end up having some trouble breathing. So yes, you need to take care of yourself. Okay. And then another one is, of course, this virus can travel to your liver and cause hepatitis. So that's another issue, hepatitis. And then we have Bell palsy. Bell palsy is, what's that? Bell palsy is unilateral facial nerve damage. So your face will be one-sided. I've mentioned this on my channel before. Your face will be one-sided, and it's, you know, you will not be able to swallow, you know, you will not be able to smile, to laugh. Like your face is just funny. It's like you're drooping on one side. Once this side is weak, and if somebody even touches your face, you're like, you know, you cannot feel your face. So this is what herpes virus can cause. And then, of course, like I said before, if you have this virus that you know, or if you have the virus that you don't know, and you have frequent outbreaks, you need to see a doctor, because you have to be followed by an infectious disease specialist. That person has to treat you, because your case is beyond primary care practice. Okay. And then one thing I'm gonna tell the patients: if you're positive, if you've been tested for this, or if you just know from what I have said, now you're like, oh, it means this is herpes that I have. You probably have already spread it to a lot of people without knowing. If you already know that this is herpes, from now on, make sure you see a doctor, so they can follow you appropriately, they can treat you appropriately. And then another thing you have to do, you have to let your partner know. If you have a sexual partner, let them know that you have this virus, because you guys have to, you have to come to a compromise. You have to figure out a way of doing things, because you don't want that person to get it, and you don't want the person to transmit it to other people. Okay. And then what else was I gonna say? I was gonna say, you can still spread this virus even if you don't have any symptoms. You can still spread the virus. So again, my goal was to keep this video below 30 minutes, and exactly it's 26 minutes. If you have any questions, please feel free to contact me. You can email me, you can text me, you can write me through Facebook, you can however you feel like you can get to me. You can call me if you need to. Again, my name is Fidelia Nabinita, and I am that NP from Cham. Thank you.